Go attend launching of 40th Malasakit Center in Valenzuela, Manila, Philippines. Senator Christopher Lawrence Bongo attended on Friday, August 9, the launching of the Malasakit Center at the Valenzuela City Emergency Hospital, the 17th in Luzon and the 40th nationwide. The event was led by Secretary Michael Lloyd Dino of the Office of Presidential Assistant for the Visayas, OPAV, and City Mayor Rex Gatchalian. Also attending was Health Secretary Francisco Duque. OPAV was a partner of the Office of the Special Assistant to the President in establishing earlier Malasakit centers when Go was still with the executive branch. In his speech, Go recounted how his vision of providing quick access to affordable quality healthcare to all Filipinos through Malasakit centers came into fruition. Nagsimula po itong Malasakit Center noong Special Assistant to the President inyong Kuya Bong. Iminungkahi ko ito sa Pangulo dahil sa mahigit dalawampung taon. Paglilingkod sa kanya, nakita ko na nakapalaking problem sa mga Filipino kapag may mayroong pamilya na nagkakasakit, he said. Let's square bracket. This Malasakit Center started when your Kuya Bong, was still Special Assistant to the President. I proposed this to the President because in my 20 years of serving him I saw how big a problem it was for Filipinos whenever a family member gets sick. Right square bracket para sa inyo ang opisina dahil bayan ang ginagamit dito. I would like lang mayo dan ipinagkatiwala ninyo sa gobyerno, he added. Left square bracket. My office is for you because it is using the people's money. I'm just returning to you what we have entrusted to the government. Right square bracket. To extend the reach of these one-stop health care centers, Go vowed to institutionalize them through his proposed Senate Bill No. 199, also known as the Malasakit Center Act of 2019, so that their operations would continue even beyond the Duque administration. The Malasakit Centers have helped thousands of Filipinos, and I will make sure that they will be able to help so many more, Go said. The first bill that I filed in the Senate aims to institutionalize Malasakit Centers. This means that if passed into law, the Malasakit Centers will have a bigger and regular budget every year, and their operations will continue regardless of who is seated in Malacanang, he added. Valenzuela City 1st District Rep. Weslie Gatchalian, who was also present during the ceremony, said that he has filed a counterpart Malasakit Center bill in the House Bill No. 2309, which requires still help to establish, operate and maintain these centers in all public hospitals. Currently, there are 11 Malasakit Center-related bills filed in the House to complement the Universal Health Care Act, which was signed into law last year. In an ambush interview, Go was asked how many Malasakit centers the government aims to build nationwide. Wala pong limit. Kaya nag-file po itong bill na mag-institutionalize mga centers, mandating not just DOH-run public hospitals to set up Malasakit centers, but also provincial and city hospitals, he said. Left square bracket. There's no limit. That's why I filed a bill that will institutionalize the centers, mandating not just DOH left square bracket Department of Health right square bracket run public hospitals to set up Malasakit centers but also provincial and city hospitals. Right square bracket. Curtailing the spread of dengue. Was also asked about measures to curtail the rising number of dengue cases nationwide. He advised the public to observe the enhanced 4S strategy of the DOH to mitigate the epidemic. May Malasakit Center din po na handang tulong sa may nagkakasakit dengue, he said. The enhanced 4S campaign stands for the following: kailangan po integration lahat ng Filipino, lalo na maraming takong dengue dahil kasagulan, Go said. Left square bracket. We need the cooperation of all Filipino, especially now that there are many cases of dengue because of the rainy season. Right square bracket. Asked about the possible revival of the controversial dengue program, Go said that experts should prove first that it would be 100% safe to regain public. Ako talaga, dapat mismo ang Food and Drug Administration at may eksperto ang magpatunay na safe ang dengue. Magpakita sila sa publiko at magpatura sila mismo para mawala ang cases sa mga Filipino, Go said. Left square bracket for me, the Food and Drug Administration and experts should prove that things ACA is safe. Let them show up in public and get themselves injected with the vaccine so that Filipinos will lose their fear. Right square bracket other health care bills will also shared with the Valenzuela residents, some the following bills related to improving health care in the country. The Advanced Nursing Education Act of 2019, which seeks to improve nursing education, SB number 395, a measure to expand the coverage of the mandatory basic immunization program, SB number 398, asks someone who travels across the country regularly to aid victims of disasters such as earthquakes and typhoons. Bill also vows to diminish the incidences of fatalities in these tragedies as he filed a bill pushing for the creation of an executive department for disaster resilience, SB number 205. This will then be complemented by another measure, which seeks to institutionalize an emergency medical services system nationwide, SB number 394, similar to the Central 911 system of Davao City. Finally, Bill also filed a bill to promote the welfare of healthcare professionals by pushing for an increase in the salaries of government civilian personnel, SB number 200. During the event, Bill emphasized his commitment and dedication to improving government services for all Filipinos. Ako po ang boses ninyo sa Senado. Kaya mas kong personal na marinagang naganahin ninyo. Mula kayong patuloy ang naming serbisyo para sa ipagbubuting bawat Filipino, he said. Left square bracket I am your voice in the Senate. So I want to personally hear your problems. You can expect us to continue our service for the benefit of every Filipino. Right square bracket /ATM. Thank you for watching. Please subscribe.